So good afternoon, everyone. Thank you for joining our webinar today on diverse approaches to safety and well-being of older adults. I'm pleased today to host this webinar in collaboration with the Canadian Network for the Prevention of Elder Abuse. And we're doing this webinar a little bit ahead of time for recognizing International Day of Older Persons, which is next week, which is on a Sunday. So we wanted to do this prior to that day to just bring some recognition to the importance of older adults and women, which is the focus of the theme this year, which Benedict will talk about in a minute. We are pleased that we have our ASL interpreters with us. So you will see them on the screen as well. Before we begin, I would like to do our land acknowledgement for today's session. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Thank you. Just a few housekeeping items before we begin. Everyone, the attendees will be muted during the webinar. The speakers for today's session will be visible during the whole presentation. We are doing this as a panel discussion, so after we do our introductions, we will be turning off the screen and you'll be able to visually see everyone in a much larger screen. As I mentioned, we have our ASL interpreters with us today. And just during the beginning session, you can make the visuals larger on your screen, either by pulling the line between the presentation and the speakers larger, or you can pin them on your own screen as well. So hopefully we also have live transcript enabled today, so you can also follow the discussion as well. If you don't have live transcript enabled on your screen, there is a button on your screen to enable that, or you can turn it on or off on your own Zoom, I believe. We encourage you to put questions in the question box. It makes it easier for us to make sure that we don't miss your questions. If you want to post a comment, if you see a colleague, you want to say something, please post that in the chat box. And we are recording the session today, which will be posted on our website either tomorrow or the next day. And lastly, at the very end of the session, we do appreciate your feedback. We'll be having a short evaluation pop-up. If you don't mind taking a couple minutes to fill that in, we really appreciate your feedback on the session and suggestions for future topics. We're always looking into making sure we're meeting the needs of our community. And in terms of privacy and confidentiality, these are public forums. So we do appreciate any personal circumstances or issues that you might want to address offline to contact our offices. You can contact either CNPEA or Elder Abuse Prevention Ontario. We'd be more than pleased to discuss something more specific if there's a circumstance that you would like information on, just respecting that sometimes if disclosing more information that you want other people to see. We just want to make sure that you're aware that this is that public domain. So just a little bit about our organization for those who haven't joined us in the past. Elder Abuse Prevention Ontario, really we envision, our mandate is to envision seniors have a strong voice and feel safe and respected. Our mandate is to do that work within the province of Ontario. But our work does expand beyond the boundaries of our provinces. We work nationally, as I mentioned, with CNPEA, as well as many other community partners in the work that we do. We are funded through the Ministry for Seniors and Accessibility, and we implement Ontario's strategy to combat elder abuse, which we've been doing since 2003 when it was launched by the Ontario government back then. And during that strategy, we have three main priority areas that we work within. The first one is public education and awareness. So we do a lot of work and education through social media to and education sessions to senior groups and organizations to enhance that education and awareness so people know how to respond, look at the warning signs, and support someone that they may be concerned of. We do training for frontline staff, and then we also work with our community partners to enhance the response and coordination of services so seniors can get some seamless support and services if they are encountering some vulnerability or are a victim of abuse. Just our organization is a small team of 8, but we're mighty in the work that we do. And within the changes with COVID, unfortunately, we have had to shift to a virtual service delivery model. We're hoping that the doors open next year and maybe we'll be able to get out and about a little bit more. But right now we are mainly delivering all of our education training through the online capacity through Zoom. And we work with our networks across the province. And as I mentioned, we work with many projects and research initiatives on elder abuse prevention. Which brings me to our website where we have all this kind of information and resources that you can access. And
I believe it's my turn.
what happened?
We're seeing the screen about CNPEA, so I can take over from you. So, hi, everybody. My name is Belinda. I'm the Executive Director of the Canadian Network for the Prevention of Elder Abuse. I'm connecting today from the unceded ancestral territory of the Coast Salish peoples, so the Musqueam, Squamish, and Tsleil-Waututh nations, known today as Vancouver. And it is my great pleasure to be co-hosting this with Ryan from the other side of the country. So about CNPEA, if you don't know about us, we're a pan-Canadian organization that's focused on knowledge exchange around elder abuse prevention, program and policy development, and generally kind of creating that sense of connectivity between the people, organizations, services who deal in elder abuse prevention, healthy aging, anti-ageism work, and trying to kind of help people connect with the rest of their community and exchange information more efficiently. So we are also a virtual organization, and you can see our work and find resources for your area or your province and territory, including support services and help services at cnpea.ca. Ryan, back to you. Have we lost you?
I'm having some feedback.
After living in Switzerland, came to Canada in 1974 as an engineering student. And as she puts it very well, has been contributing to nation building ever since, like a true engineer. Angel contributes to advocacy in many sectors such as the 2S LGBTQIA+ national housing solutions. She has helped to the development of policy formulations, and as well the implementation of and the development of the Leading and Learning with Pride toolkit with the City of Toronto, which I'm sure we'll hear more about today. Angel is a member of the Senior Pride Network in Toronto and the Older Adults Program, and sits on the advisory committee at the 519, which I'm sure some of you are familiar with. She's also on the committee, the organizing committee for the Trans Day of Remembrance, and she advocates and provides material supports such as housing, medical doctor support for continuity of trans care, education, food, mentorship, and more to trans newcomers to Canada. Next, we have Chantelle Harriott. So Chantelle is joining us as she is works with the Toronto Grace Health Centre as an assess and restore social worker, and also in the remote care monitoring program. So born and raised in Toronto as well. She attended York University and got a honors degree in both sociology and social work, and later completed a master's degree in gerontology. Chantelle has recently started employment at Toronto Grace Healthcare at the Assess and Restore social worker, and collaborating with St. Michael's Hospital GIM unit to provide support to seniors who are at high risk of readmission post-discharge from rehab. We're really looking forward to hearing from Chantelle today. Next, we have Belinda Lacombe joining us from my side of the country, from the BC Columbia Association of Community Response Network. Belinda works as a therapist and counselor in the anti-violence and anti-oppression sector. Her practice is genocide informed and advocates for a decolonizing approach to therapy and to community development. She is a regional mentor with the BC CRN, so the Association of Community Response Networks, and a provincial advisory committee member for the delivery of province-wide Indigenous Communities Healing Project, which I hope to hear more about today as well. And finally, we also have an additional guest that was not listed on the original promotional materials. We have Marilyn Brown, who is working with Belinda Lacombe through BCCRN. Marilyn is joining us from the Gitxsan territories and has also been working in the anti-violence, anti-oppression field for many years. Marilyn will welcome more details about your work and your mission as we get going. Rayanne, is everything thumbs up?
Yes, I was getting feedback on my end from a previous webinar that we hosted, so I remember what was going on. So I've shut down the presentation. So I'm not sure if it was something in the back end or not. So hopefully that doesn't happen again. So I do apologize. So thank you all again for joining us today. So, you know, as I mentioned before, we're thrilled to have everyone joining us today, and we are marking that International Day of Older Persons, and in Canada calling it National Seniors Day, which is celebrated on October 1st. This year, the theme is the resilience of older persons in a changing world, and as we know it, we know that this is a changing world based on all the things that we've encompassed with COVID and climate change, etc. And because older women are essential in leading the transformation of change across all sectors to better represent, celebrate, and protect the rights of older adults. So we are pleased that you're joining us today and to share your knowledge and experiences as older adults and women in our communities, to just talk about some different diverse approaches around how we can ensure the safety and well-being of not only older adults today, but also in the future. I do want to also, just to go back because I skipped that, is to thank Benedict for partnering in this initiative. Last year, we also did a webinar for recognizing International Day of Older Persons together as well. So we do appreciate the collaboration with CNPEA to ensure the outreach across Canada on these important issues. So the first question I'll pose to everyone, or I guess is, you know, there's a growing conversations on how to engage in meaningful conversation with older adults about safety and prevention of harm. We increasingly hear that the term elder abuse or mistreatment itself is not a preferred term or appropriate term in many cultures and languages. So some of you have made the decision or to approach this from different angles. I'm just wondering if you could tell us a little bit about that and what you find is more effective and maybe more of a safe way to approach this issue in your community. So I'm going to start with Belinda, if you don't mind, just to talk a little bit about that. And I know that you did some work with WEAD this past year, and sort of changing the context of that a bit for your community.
Absolutely. Thank you, Rianne. Yeah, I'll just talk a little bit about and the work that we've done within the Community Response Network across the whole Northwest region, really, in putting the wellness that is alive under the experience of genocide for Indigenous peoples in the work that we do in developing community response networks. You know, we're kind of working alongside this colonial system in the work that we do, and that we, you know, everything gets to be there. But what we had a really a beautiful experience, Marilyn and I, this year, where, you know, we went into community to visit. We visited 7 Indigenous communities, 7 Gitxsan Indigenous communities, where we went into and we took, you know, all the resources. So we, you know, piled up all the brochures and from all different organizations and went out there and, you know, delivered all this stuff. And the women that met us, you know, looked at the brochures and just said, no, we don't want any of that. And, you know, it's like, oh, okay. What we're interested in is really bringing alive the wellness in our community. And we know that we do that through ceremony, through language, through dance, through you know, cultural teachings in the feast hall, all of those things. So if you know, if you guys want to come in and help us to, you know, grow wellness in community, then we're really interested in having you here. And it really helped us to shift how we move in community, you know, when we do go into community. And I know Marilyn maybe could just talk a little bit about the WEAD, because the World Elder Abuse Awareness Day, it's nationally. We go out and we kind of like, you know, do events. And even the phrase itself, you know, World Elder Abuse Awareness Day, and you know, we have like balloons and whatnot, and it's kind of doesn't fit in even the languaging, yeah, so communities are saying no, we want to shift that and change that, because you know, Indigenous peoples are really well underneath the experience of, you know, colonization and the genocide that has happened to Indigenous peoples across Turtle Island. So, you know, how do we set the brochures, set all of that experience down so we can notice what's underneath there, by connecting people up with land, by connecting them up with their own bodies, wisdom, and, you know, the ceremonies and the songs and the dances that are right there in people's blood and bones, because we move with, you know, we have blood knowledge that runs, it's generations deep, that's in every Indigenous person's body. So we're really working in that realm where we're pulling forward, you know, what is it? How have we survived? Because we're here. You know, what have we been hiding underneath all of that? Because it's still there. And we just need to be able to be accessing it. And how we begin to do that is by, you know, setting down the colonial brochures and really making a lot of space and room for the beauty and the wellness of, you know, of Indigenous peoples or all genocided peoples to really come forward, because we're still here. I don't know if you want to add anything there, Marilyn.
I think you did a wonderful job in explaining a lot of that. What Belinda was talking about too is when we did an event here at the farmers market, and we had signage up where we did medicine, excuse me, sorry, with the medicine from the land that a few community members had brought and made tea with medicines that were picked from the land and was made right on site, and they talked about those medicines, and the sign that we had put up around World Elder Abuse. We were, Belinda, myself, and the couple that were with us were explaining, we were having a discussion about the sign, and the word elder was great, and abuse though kind of kind of wrong within ourselves and in our discussion. And it just, it just seemed really loud. Words have power. And so when we think about the word abuse, everybody sees that first. And those that are walking by will probably keep walking because they don't want to engage in conversation on abuse. But when we changed that, we made an impromptu heart that said big love, and we put that over the word abuse. And it just changed the whole atmosphere and the setting that we were at. And people were coming and they were talking and they were noticing. And that the feeling was just so much better and calmer and more engaging. And they were interested in knowing what we were doing with the medicine tea that was there. And they were having conversations with each of us. So it just felt a lot better. And yeah, that's just my little 2 cents for the moment.
Yeah, and I'll just add that the medicine tea itself, like the experience of drinking that tea, people started to remember, their time with their grandmothers on the land. They, the territory that they accessed during that time started to those stories started to come forward. And, as a result of those stories, how we go and do community development in community is going to change drastically. And that'll be the work of the coordinators across the region of really bringing that forward in terms of, how do we grow this wellness, and we're going out to Indigenous communities that are saying, no more brochures, we really want to come alongside and make a lot of space and room for the wellness that, is right there through the connections with land, the connection with the medicines. And the connections into the, the blood knowledge that's right there for Indigenous peoples. Yeah.
Thank you. That's really impactful to hear how the changing of the word can change the atmosphere and the tone of the conversation almost instantly. Angel and Chantelle, I'm curious to hear from you as well about this, because Angel, you work with older adults who have extremely varied life experiences. Some of them are newcomers to Canada, some of them are survivors of violence and sex trafficking. Some of them are 2S LGBTQ plus folks who live in long-term care. And Chantelle, as a social worker, are these conversations taking place as well among the groups that you work with, in the communities that you engage with? What do you hear from people you work with?
Sure.
Go ahead, Angel.
Are you going first, Chantelle?
No, go ahead. I'll go
Okay,
after.
thank you. Yeah, so these conversations are happening, but in a very different way in Toronto, in any case, because out west, it is vastly different than English Ontario. Just this afternoon, for example, I was at the Older Adults Advisory Committee, and I had proposed 6 weeks ago education on the doctrine of discovery. And I listed 6 Indigenous authors, Tanya Talaga and many others, for follow-up reading. There was a wall of silence for 6 weeks. And this is supposed to be a progressive organization at the 519. I couldn't believe, and I wrote them a terse letter saying, what is with this silence? Are you with First Nations oppression, or are you against it? So today I had the meeting, and they agreed that we need education, but in a very lukewarm manner. So I am having difficulty, and I wish I could say I had much more success, as Belinda has. Belinda, thank you for portraying, how you did things wrong and then corrected them. So I wish to learn from that also. And when I presented today, it was in a caring, compassionate way that, we need to educate ourselves as settlers. What we need the truths, because truth comes before reconciliation. And we have to know the truths before we know what it is we are to reconcile. This was in my email communication to the advisory committee, and they still did not respond. So the situation here in Toronto is vastly different from out west. Yeah, they're still in the colonial thinking, clearly. They're still in the white male Christian colonial thinking. And I am determined to change all that. Now, it may take time, but I would like some suggestions from Belinda and the First Nations participant also as to how I could approach this group. In fact, the entire organization, because on October the 3rd, I have a meeting with the director of the 519 with my proposal for the Doctrine of Discovery education for all the staff and all members of the board and the directors at the 519. They need to know the oppression and how it started, because most of them do not know. They don't even know what the Doctrine of Discovery is. Can you imagine? They don't know that. I have to explain to them what the Doctrine of Discovery is.
Yeah, there's
It
a
is
lot of
really
education.
Sorry?
Sorry, I was saying there's a lot of education to be done still.
That's right. That's my number one mission, is I have to educate them, have them read authors that are First Nations Indigenous persons, like 21 things you didn't know about what First Nations do not have. Water, they cannot own land. I mean, they cannot own land in their own land. People do not know this. And I'm talking about the directors of the 519. But here I am, a lonely person, an advocate at best, and not even a volunteer. Like I work independently. And so I do have this voice and this privilege of speaking out. And I intend to keep doing that until they hear the real story. So Belinda, please do contact me with some suggestions of how I may approach that, because it is a real uphill battle in Ontario. It is, I can sense in BC, it's vastly different.
Oh, I'm already seeing some collaborations burgeoning right here. I like it.
Yes, because I need help, to convince these directors, these people in power, that this is real. People are being oppressed now as we speak. I'm talking about First Nations people, including others, the Black diaspora, trans women of color, and so on. Because this all stems, from the colonial structures, you see, that were in place for now hundreds of years, and they still exist today to oppress and even kill First Nations people.
Angel,
The
I think
policing
it's
system, incarceration, and so on, it exists to this day, and people don't know that about. People in power do not know that, or they do not acknowledge it.
I think we have to commend you, Angel, for the work that you're doing to advocate for First Nations, and the work that you're doing to elevate the issue up to make sure people are heard, and ensuring that, and as Benedict said, the partnerships and that collaboration of learning and feeding information back and forth to each other, I think is so important. And that's one of the reasons why we do some of these forums, is to bridge that, not only the gap around, the knowledge and education, but also build those partnerships where we can continue these conversations in a bigger scope, because it does overlap, as you said, Angel, around Black communities and LGBT 2+ communities as well. So there is a lot of work that we do need to continue in these conversations. So Chantelle, I was just wondering if, as Ben, just building on what Benedict said, if you've encountered the issues of even the language around elder abuse within the social work norm that you're working in within a hospital sector, which is kind of different from the community within the healthcare sector, and sort of how you've addressed that, particularly around safety and well-being, because you must encounter that as a social worker dealing with family and different dynamics that way.
Yeah, so I originally worked in the community for about 14, 15 years. So the hospital setting is actually new to me, and I'm learning quickly. But elder abuse tends to not be a phrase that is used towards families. We don't usually say that to families. I didn't do that in the community either. It is generally used amongst clinicians, quote unquote professionals, when they are trying to explore with consultation of other professionals, whether or not a senior is experiencing that. Generally, the way that I've always approached it is more of a holistic approach in trying to figure out what is happening from day to day. I have been lucky in the community to have, enough time to get to know people, to get to, involve myself in families day to day in their lives. So being able to build a relationship first and then understanding what is happening, and then basically trying to assist versus, labeling something and then trying to solve it. Sometimes that's what people think social workers do. So I'm not always welcomed when the title is, oh, she's a social worker. So the thing is that I have to approach it a little bit differently. That I'm not there to turn everything upside down, but I'm there to actually learn and establish a connection with the clients or patients. Now I have patients before really trying to assert myself in a particular situation. But within the hospital setting, you see it on the news, pressure to send people home from hospital really, really quickly. So my role really right now has been to follow them home, which I think is really important. Do home visits, actually see how they're doing, and connect with family. And then through our remote care monitoring program, provide an actual, something that's practical that might help alleviate the pressures from the family that, they feel I have to do everything. I feel overwhelmed. I feel burdened, unfortunately, by this person's, physical condition or cognitive condition. And so that's, what I'm doing right now with the remote care monitoring program is really trying to do a holistic approach to this. But elder abuse as a phrase is not generally something that I use.
Thank you. So it seems like there is basically a consensus on this. And so that's something, that we are all becoming aware as we go. For some of us, it is in our name. It gets tricky when you're trying to do outreach and to communicate around the issue and the bigger picture of healthy aging and well-being, because what sticks out is always that word. So obviously not expecting a magical cure-all answer, but from your perspectives, what does that mean? Like what you just talked about, what does that mean for agencies and organizations that are meaning and hoping to engage with groups of older adults in their communities, and to do it well, but all at the same time knowing they're operating in a system that historically has harmed them or not been very proactive in supporting them? Like where does one start with this? And it's probably a big answer, but I would love to hear some of your thoughts about this, if you have. Belinda, do you? Yeah.
It's a big question, and I guess kind of for us out here, and the work that we're up to, it's kind of like a real simple answer, in that. The leaders are everywhere, in community, like because we are working with vulnerable populations, with people who have survived incredible, intergenerational oppression and genocide. If we are leaning into those people as our leaders, to, say, stop putting up elder abuse flags, don't hang another World Elder Abuse Awareness flag in our community. Hang a flag that says World Big Love, which is what happened there in the community. Like that to me is the leadership that we kind of need, to be able to really just hear that and honor it and respect it. And how does that transform our work? For having that experience myself in my body there was like, yeah, let's do big love. When we are together and we're pulling forward the the wellness and the big love and the teachings that are right there in the bodies of the people, of our seniors, of our elders, that's wellness that is profound. And if we can follow that, and make the work about that, and not be getting up in front of engaging this loop thing that we where we're like talking about the problems and all of that. We can talk about the problems for probably the next 7 generations, and get nowhere. And we have that experience, we know it. Or we can be like, yes, there are some things we need, those services. We absolutely need to have the social workers and all of those folks out there doing the work, the educators, and we need to make space for the wellness. We need to put more resources into really pulling forward the people in our communities who are the leaders, who have survived, who know the songs, who know the language, who know the ceremonies. Those are the folks that are our leaders. And, we're just there to, serve there and help to really grow that up, is how I see it. The simple, who the leaders are, right? Yeah, it's a big question. And, we connect our people up to their blood knowledge and their land and their territory and their culture and their songs and their ceremonies. And people are well when that happens.
Thank
Just-
you. Sorry.
Yeah.
Go ahead, Ray.
I was just going to say, so thank you, Belinda, because you talked a couple times about that leadership piece, and I think that is really key and important. And so I was just wondering from Angel, from work that you've been doing in the community, have you seen leadership happening in terms of making change to ensure the safety and well-being of older adults within the 2S LGBT communities? And maybe what does that look like in terms of that leadership?
Yeah, sadly, virtually none. And I think part of the difficulty here in Toronto, particularly, is there's so few First Nations individuals, and even less 2S individuals. They're as rare as hen's teeth, no pun intended. We have in the older adults program a two-spirited co-facilitator, and they only came late in the spring after I don't know how many years of not having a two-spirited person in our committee. And they are the only one at the 519. In an organization as large as that, about $6.8 million per annum, has no two-spirited person. So that's the difficulty I'm faced with here in Toronto. And I sincerely wish that we had more, because the elders, capital E elders, in the Toronto community area, they're fully booked. We should not burden them anymore. It is us settlers who have to do this work.
Right.
And I mentioned that in my email to the 519. It is we settlers that must take up this responsibility, because we're the ones who are privileged far more than First Nations individuals.
Right.
So
yeah, thank you for
I
that, and for that advocacy too. I think that's so important. And I know in terms of some of the work that you have been also doing, I know with the 519, but also with the City of Toronto in terms of that leadership to do either further education and outreach to try to encourage not only leadership within community, working with other partners within the 2S LGBT organizations and agencies, but also with the long-term care organizations and their leadership as well as community. I just wondered if you talk about the toolkit, the things that you've been doing with the city to sort of move that forward in the city itself and beyond, because I know that toolkit will be used elsewhere.
So just to specify for people listening, this is a toolkit called
Sorry.
Leading and Learning with Pride, which was released by the City of Toronto about a few months ago. Am I correct?
Just in July.
Oh, great. Thank you. So yes,
Yeah.
please do tell us about this a bit more.
Sure. So the toolkit, Learning and Leading with Pride, is actually part 2. There was one in 2007 rather, and it went nowhere. So when they invited me to be part of that working group individual contributor, I said to them at the outset, look, if this is just going to be a document that's going to be on the shelf collecting dust, I'm not interested. And secondly, if there's no accountability, if there's no transparency, and if there's no implementation of this toolkit, see ya. I'm not interested. So that formed the basis of the toolkit and what it is today. I told them very clearly, I will not participate if this does not happen. So it was marked down in the recorded items that this should happen. I also said that along with one of my peers, that there should be mandatory training for all senior services long-term care staff and managers. And that is now in place. And I'm one of the trainers. So on Monday this week, we did the first training session, and my next training session is October the 7th. And I'm doing training with managers, you see, from the top. And then there's 3 more after that till the end of December. And then after December is when they start gathering data as to what they have done, what these senior services long-term care have done. And I also insisted that this toolkit be widely distributed across Ontario and across Canada. And in fact, wherever people would like to adopt this policy, and I've sent it to Italy, Germany, Switzerland, and England.
That's great.
So people in these countries now have this document. And this document can be customized to the local area that they want to implement it in. So parts of it can be taken and cut and pasted into their policy. I made it so that, the lead researcher, Joseph Burley, it was constructed as such that you could take pieces of it and customize it to your local areas. There was great opposition to it, but I insisted that happened.
Yeah,
I kept telling them, if you don't do this, I'm leaving.
And I think the toolkit has shown to demonstrate that it is, very effective tool. We just, for those who want to know more about the toolkit, Benedict has posted the link there. And 2 weeks ago, we did do a webinar with Joseph to talk about the toolkit, so people can access that information on our website as well. Chantelle, has there been any sort of leadership within the community that you're working with in terms of, you know, advocating for more change or systemic changes to ensure the, you know, the services are available for older adults? And because, you know, we know that, you know, sometimes the services may not be accessible or may not even be there for them. And being a social worker, I know you play a big role, I suspect, in connecting people to those services. So, you know, those gaps, has there been any leadership or changes or programs to make that kind of thing happen?
I think I'd have to agree with Angel. I think in Toronto we have been struggling.
Mhm.
I think that you have individual agencies that are, you know, really going to the government, trying to advocate for seniors, advocate for specific programs. Um, but I think there's still the gap there.
Mm.
I think that, you know, the focus just isn't there. And I think sometimes even within my practice, I see some of my coworkers, even when I worked in the community, I saw a lot of consultation, but there wasn't any acknowledgement. So what would happen was, you know, us as a group of social workers, you know, you'd have people come to the table to talk about, you know, seniors, you know, people of color, Caribbean seniors, and their lack of trust.
Mm.
And what I found in those circles was that there wasn't any acknowledgement of, you know, the situations, the history, that really brought the person to have a lack of trust. So it's a lot of consultation, but I don't think there's a lot of acknowledgement of some of the challenges that the seniors have faced in their lives, and even in their you know, going back generations of challenges and traumas. And so I don't see a lot of that. In my practice, you know, being a person of color, I acknowledge. I think this is what helps trust be built, is an acknowledgement of what has happened. And it's not to brush it aside. It's not to put it in a, you know, put it away. It's
Mhm.
acknowledge it, and also acknowledge that, you know, my role as a social worker is to assist with safety, to assist with the concerns that the patient or client has. Um, but again, I go back in terms of leadership. I think we're still,
Mhm.
Toronto's still struggling. I think again, it's very individual agencies trying to come together. You know, like now that I'm at Toronto Grace, I find that our CEO tries, and you see him at the table, you know, trying to advocate. But I think it's going to take a lot of that in Toronto to really get us going.
Yeah, I think you build on your, you know, a good point around that education of knowing the history and understanding that. Similar to, you know, Marilyn and Angel, what they were saying is how do we reach the, you know, the healthcare worker, let's say, you know, doctors, nurses, etc., everybody that works in that system, to have a better idea of what people may have gone through in terms of the trauma over history, maybe why people are making decisions because of that. And not knowing that can, you know, continue to, you know, build the, you know, as a challenge, and builds, you know, that lack of trust, as you were saying. So, you know, that may be one of those recommendations that comes forward to do that further education training, not only when we were talking about, as Angel was talking about, you know, understanding the, you know, historical issues. I think Marilyn and Belinda as well, but it's the same thing in the Black community as well, because I don't think people kind of maybe recognize, or maybe the visibility of the issues are not in the forefront. So how can we better do that as a community, as a province, as a country, to ensure that the needs of older adults are addressed? Benedict, are you going to say?
Yeah, I was going to kind of follow up on that, because I know that there's been growing conversations around matters of, you know, cultural competency, cultural safety, to be able to deliver better care, safer, appropriate, respectful care to people from various communities. And are you aware of specific initiatives right now, or maybe even resources that we can maybe share with our audience through the chat box and during this conversation, that could help people who want to kind of get into this, further their knowledge, and maybe like Angel's resources, kind of take some parts and even just apply them into their policies when providing care, healthcare, or long-term care services?
Well, I know you have the Black Alliance. There
Mhm.
is a website that I have used. I know that originally you reached out to Dr. Norris to do the presentation. So we used information from their site, also cited some things in her paper that she's going to have published. And that website is really helpful because you do have an element of just, this is the Black culture, this is a Caribbean culture, and just being in, having the acknowledgement that there is still intersectionality within the community. I find that Black Alliance does have that. There is that knowledge of it. And I see that they have articles, they are doing outreach, especially around seniors. We are trying to, unfortunately in healthcare, sometimes you do, and I think Rayanne spoke to this really well, is that people make decisions, based on culture, based on what they've experienced, and you don't always have that acknowledgement. I feel judgment sometimes comes out instead of acknowledgement. And I've had lots of examples of that now working in a hospital setting where, a doctor might suggest that this is what someone does and they don't do it. And it's just like, well, why didn't they do it? Whereas I guess because being a part of, a community, I'm a person of color, I can understand, that there are histories in the Asian communities. There are histories in even cultural communities in Portugal, in Italy. Like it's really rich. And so I think that's a really important piece, is that we would like to provide more education to physicians, to doctors, to the hospital setting. And they kind of come back with, it's so busy, it's too much, we have too much pressure, we have, like it's a lot, we got to push people out, especially seniors, if they have a social issue versus a medical issue, we got to get rid of them, and it's hard to watch, to be very honest. And that's why I'm quite happy with what I'm doing in following them home to continue to support them, because right now the hospital system isn't built that way, especially for a senior. That acknowledgement of culture, the acknowledgement of race. Um, right now in Toronto, especially in our Toronto hospitals, you're not going to see that acknowledgement, because it's really you're in, or you're healthy, it's time to go. Even though there might be so many social things going on with them. And you hear, we have a new bill, people are pushed out. So yeah, I like the Black Health Alliance as a good starting point for people to educate themselves. Like they're doing some really good work. But I also just want to mention that being someone who's been in community and now in hospital, I see how different things are, one versus the other. And I just want to speak to the pressures that the hospital's seeing right now from the government level. And that in terms of a senior, it's difficult to be in the hospital. It really is.
Yeah, I mean, those changes, I think everyone's sort of, trying to understand and adapt and try to figure out the best way to ensure the safety and well-being of those residents who may have to move into a long-term care home. Marilyn, I was just wondering, there's a program, and I had the name written down and I had lost it. There was a program that you were developing. It was called Medicine.
Magical Medicine Backyard.
Thank you.
Magical Backyard, sorry.
Yes, and I just wondered if that has been used as a tool to educate individuals, or build that competency for individuals and leaders in communities.
Yes, that one's available on Facebook, actually. I could look up the link, would take me a minute.
It's okay, Benedict.
But
I have it.
Yeah,
yes.
So it's a great resource page to explore what land medicines are, and every province, we all have medicines on our land. It's just a matter of getting to know what those medicines are. And as Belinda had stated so beautifully, blood knowledge, we know what medicines are good for us. And to a friend of mine, she always says she learns one medicine a season, because every season brings different medicines and ways of using it as well. And I think it's really important, which I didn't say in the beginning when I started to talk, is that my Giksan name is Oetsin Gabu, which means spirit wolf. And I just recently inherited that through my mother's headstone settlement feast just this past weekend. She passed away in 2018, and my mother had taught me so much about our culture and how to connect, and the importance of knowing where we come from. And individuals such as Martin Brokenleg, I don't know if all of you are familiar with him, but he has an amazing way of talking about the genocide, about what the sense of belonging is, and changing that direction of what the oppression has done to so many of our people. He lives back east, so you have better access to him than I do. But he would be an amazing resource of bringing information to the understanding of what the oppression is. And the IFOT as well, as Belinda explained, the Indigenous Focusing Complex Oriented Trauma Therapy. Myself, I took the year training to be an IFOT practitioner, which I use through my work. And there's also the Indigenous sorry, I forgot what the name of it is already. I call it stage fright right now. The learning the baskets of what the Indigenous Tools has to offer. There's another program that's a shorter one than the 1 year training. And ITFL, Indigenous Tools for Living. There we go. Just had to squeeze that out of me. But I was just wanted to mention that the few things is, like, I feel very privileged to where I sit right now as an Indigenous woman of Giksan territories. I am also the victim service worker in the area, which kind of goes hand in hand with the BCCRN that I'm also taking on, which I'm brand new to. I know that I have to set very strong boundaries about what kind of work I do for BCCRN, because when I have, as victim services, report a referral made when there's elder abuse, then I have to respond to that in the way that I'm supposed to as victim services. And that's where the abuse definitely becomes a very serious issue to deal with. But on the other side of it, as BCCRN, bringing information and resources to each of the communities. There's 7 communities here in the Giksan territories, Indigenous communities, plus the 3 Hazeltons, Old Hazelton, South Hazelton, and New Hazelton. They're all in separate sections surrounding the 7 communities. So I see many programs like working with the hospital here. I see myself as a bridge. I'm myself, like I said, I'm Giksan, but I'm also Finnish. My biological father is Finlander. So I feel like I have a bit of a taste of both worlds. And I grew up off reserve, but I'm now living on reserve. And the experience is huge. The learning curve about living on reserve has been a real eye-opener for me. The whole area is fishbowl. We live in a small sections of community, and you can't just leave your job at home. You can't ever leave it at the office. It comes home with me, unfortunately, and I have to have healthy, strong boundaries about it. And how do I connect and not feel like I'm being rude when I say, call me on Monday? I don't do that. So there's so much complexity around all of this. And I'm excited about being in the BCCRN field and connecting with seniors, and we call a lot our elders, but mostly when we're talking, because elders in our community is a cultural thing, and you don't have to be 65 to be an elder. So I have to really be clear about that as well. But I am excited about being in this, and the last thing I guess I just want to say is building on the cultural strengths of each of the communities and what each community is doing, because we have a community 40 minutes away from the other community, which is like we have a U shape of all the 7 communities. The farthest community could be doing something different for the seniors in their community as opposed to the one on the opposite side. So we have to meet everyone where they're at in each community, what they're doing and how they're building the strengths, and you know which chief is in each on each reserve, and it's just meeting each to where they want to start from, and bringing the information about how to address when there's abuse going on, or in whatever. We all know the different kinds of abuses that there are, from financial and spiritual and so on. So that's what we do, is that build on the strengths and be action oriented. I always talk to the RCMP about that, getting involved in events like this Friday, September 30th. Reconciliation events are happening all over the area here. And so my part is to go there, and I'm going to be the leader in making soap berries. It's an Indian ice cream. We whip it by hand, and we have lots of fun doing that. It's a contest to see who can make the best soap berries and what their teachings are, like your mother, what she taught you on how to make these berries, because it's a very strenuous hard work to make by hand, because it's whipping. Can you imagine whipping whipped cream from the store by hand and not using a mixer? That's kind of the same thing.
That sounds exciting.
Yeah, so
and good teachings, right? And
yeah, for sure.
I like your comment, and I was just thinking, I was writing it down actually, and you said it already, was, we have to meet communities from where they're at, because everyone may be taking a different approach and at different stages, and different leadership, and working with that community, I think is so important. And Pink Angel, I see you got your hand up there. Would you like to comment?
Yes, thank you, Rianne. And a special thank you to Spirit Wolf for narrating how positive things are with her, with Spirit Wolf, and the work that Spirit Wolf is doing. This is like the model that we should adopt here in Ontario, particularly in Toronto. And I would like some guidance on that also, but the trouble is, I cannot do it because I'm not First Nations. I'm actually South Asian from India and born in Kenya. So therein lies that disconnect. So I would definitely need help and to promote these teachings, these First Nations teachings that have been lost due to colonization. They need to come back, because these are the real teachings of the land, and this blood teachings of hundreds of generations since time immemorial. So a lot of education has to take place in white Ontario. And I also would like to thank Chantelle for bringing this, for acknowledging that there is gaps that exist here in Toronto. And then it came to me as this light bulb. I'm going to propose to Joseph Burley that we have a roundtable, a panel discussion with the managers of senior services and long-term care of how they can better deliver and prevent elder abuse in the 10 long-term care and beyond Toronto. So this is going to be my next proposal to Joseph Burley in the next week or so, that we have this roundtable with all the managers. And the reason how I came to that is because on Monday, a manager was at the training session, and he said to us, he doesn't know how to deal with people who do not follow the policy. And while I said to him, well, if in a standard workplace, if an employee does not follow the company policy, they get written reprimands, and after the third one, they are terminated. There's a process. So, he didn't know that. And we need to teach these managers Ontario Human Rights Code and the obligation that they have to enforce it. So a lot of education needs to happen here in Ontario, and particularly in Toronto. As I said, Ontario and Toronto is white as a page. This needs to change because Toronto is a financial center, and all the structures of white colonialism exist here in really large ways, and so it's a real challenge to overcome that. But I'm adamant that these people be educated, these people in power be educated that yes, you're white, but you need to make amends. You need to acknowledge that your privilege is oppressing not only First Nations persons, but every other who is not white.
Thank you, Angel. And I do not mean to rush this at all, but I do see that we've talked for a while, and I think people might have questions. We have a first question right now in the Q&A box, and please do share your questions. Right now is the time. But Michelle is asking, or stating first, that one of the big challenges is that for a lot of community leaders, and I think that applies to leaders as well in other sectors and organizations, they're dealing with so much at one time. So how do you increase the priority of putting the lack of wellness that some older adults experience? How do you help push that to the front, especially for those who are members of minorities? How do you help leaders manage all these priorities that they have to deal with, to put that on their radar as well?
I could speak to that.
Mm-hmm. Go ahead.
So just this past Monday in the training session, we covered a lot of this ground. Because the same manager who didn't know what to do also said, they're overwhelmed with providing care. And this is true. But what they need is a point person in that organization to deal with this. A champion, an ally, or someone who's actually paid to do this work of enforcing the diversity, enforcing the Ontario Human Rights Code, and educating the staff and the management of how to approach senior services, long-term care provision for elders in a sensitive way. So they need that one specialized person in every single long-term care and other organizations. And they don't particularly have to be Two-Spirit or LGBTQ. They can be persons who are qualified to do this work, who know the issues, and who are willing to put in the work so that we prevent elder mistreatment, elder abuse, and we promote what Spirit Wolf said, these magical narratives of First Nations. They need to be centered because it's a positive story, you see. And when people realize, that there is a different way, I think they will be very responsive, because all they've heard is abuse, abuse, abuse. Well, it's very negative. But when they have an alternative that, love is the way to go. Kindness and compassion and caring for each other is the way to go. So the narrative has to change in this white Ontario. And I really commend Spirit Wolf and Belinda for making that connection. So it's been really helpful for me in particular to be part of this conversation today, to change that narrative, and I strongly feel that that narrative has been going on far too long and far too negative, that, we must change this worldview from a negative to a positive view. So yeah, I thank the participants today, because that has also shifted the way I am going to approach future advocacy, to be more positive, to have these narratives from a First Nations perspective, and I hope I do them justice. So I need to learn more myself.
Thank you, Angel. Chantelle, I see you raise your hand.
Yeah, I think to piggyback on what was said is that you do have point people. I think the way that organizations, the ones in the community, even in hospital, the way things are set up is that you do have like CEOs and then things trickle down. And I think even a manager being able to appoint someone who can lead what I think is wellness. I think Belinda's point was excellent in that, we are moving away from the word abuse, and I think we need to talk about wellness. And you do have some organizations that really do focus in and have point people who are just focused on senior wellness and bringing people together. And, again, I speak to my role in that hospital is very different, but the idea that there is a point person. I have a manager who says, you're going to go out there and you're going to ensure that you are doing a holistic approach to this person's care, ensuring that both the patient and his wife or his partner or his kids or whoever is managing the care is, being acknowledged, and that, you're going out there to provide care over time. And I think it's important that, managers acknowledge that this is an issue, because if I think about the hospital system, we're trying to prevent readmissions. And what you do see when you just send people out, especially seniors who might be experiencing, issues at home and challenges at home with their family or without, is readmissions. So I think sometimes managers, and even I should probably go higher than a manager, director, CEOs like to see is that the care following the person out of the hospital, actually providing the holistic approach, there's stats on that, right? You see less admissions. You're seeing people not feeling as stressed at home. There are things in place, like I mentioned, remote care monitoring, which is a device that we use. It's similar to what people would call Lifeline, but is free of charge. And I think sometimes you have barriers that get in the way of adding to supporting people at home. And you also have families who just feel absolutely overwhelmed, and then you start to see elder abuse can happen with the level of stress and caregiver burden that takes place. I mean, you also see on the flip side that, the levels of caregiver stress and burden may not be there, but there is still elder abuse taking place. But again, I think there are agencies, where I used to work, worked at Sprint Senior Care, you had wellness as a department, and that was their goal: go out there, have programs, food programs, exercise programs, try to keep the seniors as well as we can. And then you also have social workers. Social workers, please ensure that you are doing your assessments, that you are building relationships with these seniors in the community, so that they feel trust and they can reach out to you when things aren't going as well as we'd like. So yeah, just to piggyback, I think you can assign point people. I don't think it always has to come from the very top. Obviously, the way that businesses, organizations work, it can't always be that way. But there is an ability to focus in on wellness if the agency or organization feels that it's important enough to really combat, the idea of elder abuse. But also the spin is important. I think wellness should be the better approach, which is a positive approach, which I think is wellness.
Mhm. You're muted, Benedict.
My bad. I don't think we have a new question just yet, but I had one earlier which I forgot to ask, so I'll just get in there. When I know that in our work, Rayanne and myself, we very more and more talk about and hear about the importance of intergenerational relations, intergenerational work, and intergenerational connections to help stave off social isolation, to help change mindsets that are quite ageist, and as a result, to kind of lead to an extra layer to counter risks of mistreatment or overtreatment later. Is that something that is a part of the work you do? Is that something that you've observed yourselves as well? I'm assuming that some of the work, for instance, Marilyn, that is taking place in your community and among the BCCRN that you're involved in might, but I'm curious to hear about that.
Sorry, was that directed at me?
Yes, sorry, Marilyn question mark.
I just want to clarify what you're saying is that, sorry, you have to.
Sorry, yeah, it was a bit of a, so is our intergenerational relations and intergenerational activities at the heart of what you do? And do you consider them an important part of the work for the well-being and safety of older adults?
Absolutely, it's the heart of, that's where I'm building from, is taking those steps into connecting strongly with the culture and with the understanding of, you know, meeting each elder, each senior where they're at in whether they have addiction issues or they're isolated, working with programs that are already in place within each community. They have different programs like cooking a lunch for each of their members within each community. It's a lunch program, and so we bring information like I can give my card to attach it to their lunch that's delivered to them, and it's kind of like doing an overall blanket assessment through the work that I'm doing as BCCRN, but also as victim services and as an individual Indigenous woman myself, in learning what each of our communities are doing. And the cultural aspect of it is bringing the positives of, you know, we have conversations within activities at each hall within the community, such as like with language, what was the common word used that everybody knows as way of communicating when you're not happy with something that's been done to you. And one of our words was hotwit, and it means stop. And from the kids to all the way up is reconnecting to our language in that sense. And I think in any nationality, we all have different words that mean, that's a strong word, that when you say that word, you have to abide and stop whatever it is that's happening. Because in the Indigenous communities, the language is slowly disappearing, and we're trying to bring that back. And so using simple things like learning, what did we use when something is happening to you? Like if a teenage girl is with her boyfriend and, you know, they're exploring and they're taught the word hotwit. If your girlfriend, or even the boy, if you're going too far, it's hotwit. It means stop. And that's the language we're talking about when it comes to even sexual violence. You know, you want to be able to have something that's powerful. And so even with our seniors in our culture, it's, if you're not happy with what's happening, if a daughter is talking harshly to her mother, her elderly mother, And when mother says Harriott, it means stop. And everybody stops and realizes like, okay, I've gone too far across a boundary, across the line. I kind of got on bunny trails there.
That's okay. And I think that's important in terms of, educating people at all generations about, violence and prevention. And because, what they learn, they pass along as they get older, and how they treat older adults as well. So, the teachings and the connections of, even doing, the blueberry kind of thing of working together, but building that wellness that we were just talking about. It seems maybe like a small activity, but it really does. It's bigger than it actually is, and has more impact, I think, than some people may not even internalize, but it really does, I think, have that long lasting building relationships, positive well-being, and those connections within families and beyond within their communities. Angel, I see you have your hand up, and I think maybe we have a couple more minutes, and then we have some final slides, but other than that, so go ahead. Oh, it's muted, Angel.
Sorry about that. So in my work with intergenerational individuals, particularly in the trans women of color community, I have been mentoring so many of them, upwards of 30. And I have been teaching them how to look after elders. And now they're taking courses in PSW and onto nursing. So this is important work for them to know that elders here in Toronto, they need your help, because I have shown them kindness and caring by providing for them housing, food, clothing, language training, education, employment, and they are inspired by that to help the next generation. And in fact, the generation past also, like the elders, small e elders. So this is happening currently in my work, that I didn't intend it to be that way, but it turned out that way. So I'm quite pleased that that happened, that they are taking the initiative themselves by way of example, and their mentoring to take upon this responsibility and duty to care for the elders in a very sensitive way, because they themselves are trans women of color. So they will look after other trans women of color. So yeah, that's what's been happening. That's one of the positive points currently ongoing in my work. Thank you.
That's great, Angel. Thank you for sharing that. Chantelle, is there anything happening within the work that you're doing in terms of with intergenerational building and community?
Unfortunately, I'd have to say no. Used to, but not now. Not in the hospital setting. Unfortunately, I think COVID has changed a lot.
Yeah, that's true.
What can happen. I know in the day program settings, even that has changed with COVID, but it was a big part of day program. It was really important that, you connect with a school in Toronto, and, I think it was I want to say 8. We had grade 8s come in every year, during the school year, to sit once a week with our members. Most of our members were those with dementia, but we did that every year, and then COVID. But I thought it was very important, and you get to see them connect, hook up with the school. Other day programs in the city did used to do that as well. It's very important, I think, to really have, the younger generation have experiences. Some people, unfortunately don't have that connection with their grandparents. Maybe they've passed or they live at a distance. So giving them the opportunity while they're in school, spend a day at a day program, listening to stories, listening to, what the person used to do for a living, and you might want to be a dentist too, sort of thing. And I think it really, it's wonderful to see. I hope as things are kind of getting back to normal, you will see that when it comes to a day program setting, connecting with a school in the city and them having that dialogue. So
Great. Benedict, is there one more comment or a question? Oh, we have.
We had one more question in the Q&A box, but I think Marilyn has actually addressed it in writing. It mostly concerned that for some older adults, they have internalized the mistreatment that they're experiencing, and how do you help them change that perspective and maybe take action? And so Marilyn responded to say, the big steps for change, they usually start small. So it's talking about finding a strong leader within their family or the community to live in, looking for an advocate within a friendship center, for instance. And I think they always seem like such small, simple steps or answers, but they are truly how you crack that door open and how you lead a more transformative way of looking at a situation is. And I think, Rayanne, I don't want to reveal too much, but you have some videos on the way that are going to come out soon that sort of address this of, how to talk to somebody you're concerned about and how to ensure that they feel a sense of agency in their own situation, their own life, on taking the next step. And people are more likely to do something about what they're experiencing if they feel like they have the support of people around them. So sometimes it's just one person, finding one person that will take the time to have a conversation and let the person talk at their own pace. It is not a satisfactory answer when your urge is to help as fast as you can, but sometimes speed is unfortunately not the way. So I think that is it for questions, Rayanne.
Great. So thank everybody for sharing your personal experiences and your knowledge, and also sharing recommendations for moving forward. I think there's been a lot of good points. I know I was writing some things down as people were speaking. I know that some of the comments and questions that people were posing, that they have things to share and resources. So I do appreciate your time to do that. The work that you're doing in your own communities to advance the wellness of older adults and the safety, and bringing that through the generations, as we were just talking about in terms of intergenerational, the connections and changing the leadership. I think it's an ongoing task and challenge that we all continue to face. But as we all work together in our own ways, as Benedict says, we all have each has a role that we can play in terms of supporting older adults and taking that on as a leadership. I know, Angel, you've talked about that in terms of, going up the ladder, and same with Chantelle, is we all have to, it's more voices. The more voices we have, the better we'll be heard, in another way and approach that we take to get that message across. So I do thank you. As we wrap up, I do want to remind everyone that we do have a couple webinars that are coming up next month, which is Cybersecurity Awareness Month. So we have a few webinars focused on that. So on October 12th, we actually have another panel discussion on different cybersecurity programs and tools and resources, very practical information and resources that people can share and use to not only make sure their own cybersecurity is intact, but also looking for their older adults to ensure that that's in for them, as well as agencies to pass on to clients. And then on October 26th and 27th, we're doing a webinar on online frauds and scams. We have a speaker from the Canadian Anti-Fraud Centre, so we have the presentation in both French and English available, so you can register for those now as well. And as Benedict and I always say, if you want to donate to either organization, we are continually to strive and do fundraising for our organization. So if you feel that you would like to contribute in some way, we greatly appreciate that as well. And here's our contact information for our speakers if you'd like to make further connections or find information and resources as I mentioned today. I will post the links that were posted today in the tools that were suggested and information. I'll put those with the PowerPoint presentation when the recording is uploaded to our website as well. Just a reminder that we will get a little message about evaluation. So if you wouldn't mind filling that in, we'd greatly appreciate it. And if you'd like to contact either Benedict or myself, please reach out to us either by phone, email, social media. We're here to help and move issues along, both on a national and provincial level as well. So thank you all for joining us. Thank you again for our panel members and our ASL interpreters for joining us today as well. We greatly appreciate your support and involvement today. Benedict, do you have anything to say?
No, that's it. Just thank you so much for your generous participation today. I really got a lot out of it, and I think our audience did too. Truly appreciate you taking the time, and hopefully that's just the start of our conversation.
Great. Thank you, everybody.
Thank you.
Bye. Have a great day.